السلام عليكم، اسمي سطام الزهراني. أنا طالب طب في السنة الرابعة بجامعة الإمام محمد بن سعود الإسلامية. اليوم بنشرح عن الليفر. بنتكلم فيه عن البيناين ليجنز وعن المالجنانت ليجنز وعن الهيباتيك سيست. أول شيء بسم الله نتكلم أول شيء عن these are the objectives. We will explain the common signs and symptoms related to liver and biliary system, ability to build up relevant differential diagnosis. هذه كلها الobjectives حقت السيرجري بلوك السيرجري محاضرة الليفر. طيب كمل. First thing, we will start off with common hepatic lesions. We have hemangioma, we have focal nodular hyperplasia, and we have liver cyst, and we have hepatic adenoma. These are the benign lesions of our topic today. Then we will move to malignant lesions, primary liver cancers, hepatocellular carcinoma, fibrolamellar carcinoma, cholangiocarcinoma, and metastasis. First thing, let's start with hemangioma. What does hemangioma mean? Basically, hemangioma is benign proliferation of blood vessels. Could be found in the skin, could be found in many internal organs. We will be talking about hemangioma of the liver. It is common benign liver tumor due to venous malformation, as I mentioned, blood vessels proliferation, abnormality in the blood vessels, occurs in ages between 30 to 50. Always pay attention to the ages, because the ages can direct you into the differential diagnosis. Biopsy is contraindicated. Why is it contraindicated? Imagine that you have an organ that highly vascularized with blood. So you have lots of blood vessels. Whenever you will insert a needle, you will induce hemorrhage, and this hemorrhage will be massive. You will not be able to stop the bleeding. So that's why biopsy is contraindicated if you suspect hemangioma. It is usually asymptomatic, meaning it is discovered incidentally. People don't complain about it most of the time. And pay attention that it is the most common benign liver tumor. This is hemangioma. This is hemangioma of the skin. But you can see in hemangioma there is proliferation of blood vessels. You will say that this is hemangioma of the skin. I will say to you, yes, this is hemangioma of the skin. But in the liver we have the same morphology. We have the same blood vessels. We have the same structure. These are the same tumors. So in the liver we have the same thing like this. So that's why biopsy is contraindicated in this condition. Whenever you will insert biopsy, you will injure these blood vessels, and you will result in massive bleeding. And eventually, maybe you will end up with hemorrhagic shock. Okay, this is a question. We have a well-defined, uniformly hyperechoic liver mass with peripheral feeder blood vessels that are characteristics of. These are characteristics of hemangioma. On which diagnostic modality? These are features of hemangioma in ultrasound. Pay attention to hyperechoic liver mass. You can see here the echogenicity of the liver. It is white in color. This indicates it is hyperechoic and with peripheral feeder blood vessels. Unfortunately, in this picture or many ultrasounds, you will not be able to detect peripheral feeder vessels. But keep in mind, whenever they say hyperechoic liver mass, that means with peripheral feeder blood vessels, with peripheral feeder vessels, keep in mind that we are talking about hemangioma. As I mentioned earlier, hemangioma is made up of blood vessels. So peripheral feeder vessels, as we saw here, that means we are talking about hemangioma. Hyperechoic indicates ultrasound. You can see here the mass. Okay, this is another question. We have peripheral nodular and discontinuous enhancements and progressive centripetal fill-in. Okay, what does centripetal fill-in mean? Centripetal means starting from the peripheries and moving toward the center. Again, starting from the peripheries and moving toward the center. This is pathognomic feature of hemangioma. But this is in which diagnostic modality? This is seen in CT. You can see here, this is A, B, C, D. Starting from here, this is the contrast. You can see the aorta is shining here. Starting from the peripheries. شوف الكونتراست هنا، الكونتراست واضح على الأطراف. بعدين في الصورة الثالثة يبدأ الكونتراست يدخل في النص، يدخل على الأطراف. وفي الصورة الرابعة خلاص الكونتراست عبى الليجن بالكامل. فهذه pathognomic feature of hemangioma on CT with contrast. Okay, now we will talk about MRI of hemangioma. We have hypotense and we have hypertense. In hypotense, it is well defined in T1, and hyperintensity that increases with econ time on T2. Okay, keep in mind, we have a note here. We will be, this rule, we will be using it for the whole slides. As we move along forward, we will be talking about this rule. As you can see here, number 1 is smaller than number 2, meaning number 1 is hypotense. As we move to the right, the hypertensity increases. So number 1, hypotense. Number 2 is hypertense. We will see the image. Okay, this is hepatic hemangioma. If you follow the rules, you will know which one is hypertense and which one is hypotense. You can see here clearly, this is T1. Sorry, this is T2. And you will see here, this is T1. This is hypotense, and this is and on the left is hypertense. It is shining. So T2 is shining and T1 is hypo, not shining. Okay, we have finished from خلصنا من الهيمانجيوما. بنتكلم الحين عن الفوكال نودولار هايبربليجيا. طيب وش سبب الفوكال نودولار هايبربليجيا؟ السبب غير معروف. The most common theory is the development of vascular malformation that's associated with female hormones and oral contraceptives. لما يقول لك هو الثيوري ان ال vessel malformation due to female hormones and oral contraceptives, this immediately gives you a hint that females are more commonly affected by focal nodular hyperplasia than men. Okay, morphology of focal nodular hyperplasia, if you see it on radiology, it looks like a central scar with radiating septae. Central scar with radiating septae. What does that mean? You will see hypodensity in the center with some radiating fibers that we will see now, and you will understand it. Okay, this is the second most common benign hepatic lesions. Do you remember what is the first one? The first one is hemangioma. So the second is focal nodular hyperplasia. It is usually asymptomatic, but sometimes they cause minimal pain, hence discovered incidentally, but most of the time it is asymptomatic. Okay, focal nodular hyperplasia and microscopic features. We have benign appearing hepatocytes divided by fibrous septum. Okay, atypical biliary epithelium that's scattered around the lesion. So benign hepatocytes and biliary epithelium is abnormal due to fibrous septae. Okay, how to diagnose focal nodular hyperplasia. لو تستخدم الالتراساوند بتشوف انه looks like a solid tumor. So that's why we don't use ultrasound for diagnosis of focal nodular hyperplasia. We can see it, but you cannot confirm the diagnosis. The modality of choice for focal nodular hyperplasia is CT scan with contrast, showing a central satellite scar. Focal nodular hyperplasia has no malignant potential. That's why we don't do anything about it. So, unlike the other lesions like hepatic adenoma that's associated with malignant potential. So, focal nodular hyperplasia is not malignant and the treatment is not required. Always, when you study, just try to compare with the previous lesions. For example, the diagnosis of focal nodular hyperplasia is mainly by CT. Hemangioma, you can diagnose it by both CT and ultrasound. Focal nodular hyperplasia is not malignant, لكن في hepatic adenoma is malignant. So always try to compare between the both. At the end, you will have a clear vision, and you will be able to differentiate between the lesions easily. Okay, this is a CT of focal nodular hyperplasia. You can see here a central scar. شوفوا السنترال سكار اللي هو باللون الأسود. هذا السنترال سكار يسمونه في الفوكال نودولار هايبربليجيا. وطالعوا هنا الهوموجينيسيتي. في الفوكال نودولار هايبربليجيا كلها هوموجينيسيتي. اللون نفس اللون هنا، نفس اللون هنا، نفس اللون هنا، نفس اللون هنا، نفس اللون هنا. فيسمونها brisk homogeneous enhancement. It is well defined, although it's not very well defined. You can see some bulging masses, لكن it is considered defined compared to other lesions. Hypodense fibrous bands and septae arising from the scar. تشوفون الخط الأسود هذا يسمونه السبتاي. وفي هنا other septae لكن تغطت بالكونتراست. في الديليد فيز اللي هي يسمونها البورتال فيز، السنترال سكار will shine eventually. يعني السنترال سكار هذا في الأخير بيولع مثل الأجزاء اللي حوله. And it is not capsulated. That's clear. You can see the borders are not sharp. Gives you a hint that this is not encapsulated. Okay, this is a histological feature of focal nodular hyperplasia. عشان نبسط الأمور، طالعوا السنترال سكار هنا وطالعوا الفايبرس سبتي. شوف هنا خط وهنا في خط وهنا في خط وهنا في خط. هذه يسمونها الفايبرس سبتي، وهنا السنترال سكار. هذه CT of focal nodular hyperplasia. You can see the central scar here. طالعوا لو تشوفون هنا تدققون بعد شوي بتلقون fibrous septae وfibrous septae وfibrous septae. في الأخير السنترال سكار هذا بيولع والأجزاء هذه بتطفى. يعني again الأجزاء الأطراف هذه تولع بدري، بعدين تتحرك لين النص، بعدين يولع السنترال سكار، بعدين الأجزاء هذه تطفي ويقعد السنترال سكار مولع فترة بعدين يطفى. شوف هذه في الارتيريال بيز. في الارتيريال بيز السنترال سكار is طافي مو مولع. اوكي هنا نشوف في الفوكال نودولار هايبربليجيا we can diagnose it also Doppler ultrasound. In Doppler ultrasound, you will see lots of central vessels. You can see here central vessels. This is another feature or another diagnostic modality for focal nodular hyperplasia. Okay, MRI for focal nodular hyperplasia زي ما قلنا أول قلنا ال T1 he's hypotense وال T2 he ال hypertense. Isotense to hypotense is T1. Slightly hypertense or isotense. لكن عشان تسهل على نفسك احفظ إن ال hypertense T2 وال hypotense T1. يعني هنا تخيلوا مثلا ان هنا في T1 هنا hypotense ولما يتحرك هنا يروح للhypertense وهنا T2. ف T1 moving to T2 becoming hypertense. وبريسك homogeneous زي ما قلنا قبل شوي شفتوا في السي تي انها بريسك homogeneous كل الماس نفس اللون. delayed enhancement of the central scar زي ما قلنا قبل شوي يكون في delay enhancement لما الأجزاء اللي حول الفوكال نودولار هايبربليجيا تطفى السنترال سكار يولع في الأخير. Here is the note. Always remember 1 is smaller than 2. 1 is hypotense while 2 is hypertense. Okay, now we will move to hepatic adenoma. Okay, hepatic adenoma is also called liver cell adenoma, another name. It's a benign proliferation of hepatocytes. It is associated with oral contraceptives. Keep in mind that focal nodular hyperplasia and hepatic adenoma are both associated with oral contraceptives. But to be more specific, which one is associated with oral contraceptives is hepatic adenoma. It is solitary lesion, only one. It is associated with right upper quadrant pain. If you compare it to the previous lesions, we say it is asymptomatic, or sometimes they cause vague abdominal pain. While in hepatic adenoma, no, it causes right upper quadrant pain, it causes sharp pain, localized pain. So this is a characteristic of hepatic adenoma. Unlike the previous lesions, it is surrounded by capsule, meaning it is well demarcated. Surgical resection is recommended if symptomatic. يعني إذا كان الواحد عنده الهيباتيك أدينوما ووضعه إذا كانت فيميل وعندها هيباتيك أدينوما ووضعها تمام ما تحتاج السيرجيكال ريسكشن. أما إذا كانت تحس بأعراض أو إن الليجن حقها أكبر من 4 سنتيمتر يعني 6-5 حتى لو كان ما عندها أعراض لكن الليجن حقها أكبر من 4 centimeters, she needs to do surgical resection. Okay, first thing we treat it by stopping the oral contraceptives and we follow up نتابع الحالة بالسي تي نشوف إذا انكمش الليجن معناته إن الكوز oral contraceptives فالأمور طيبة. لكن إذا ما انكمش الليجن معناته maybe this is not hepatic adenoma, maybe this is a malignant tumor or something like that. So we need to do surgical resection. And keep in mind that hepatic adenoma is associated with malignancy, can transform into malignancy, unlike the focal nodular hyperplasia. Okay, what are the complications of hepatic adenoma? Rupture. If it ruptures, it will cause massive bleeding, life-threatening, intraperitoneal hemorrhage. And second thing, it has potential for malignant transformation. Please keep in mind, this is the benign lesion that's associated with malignant transformation. Okay, what are the radiological features of hepatic adenoma? Shows heterogeneity in ultrasound and CT scan. قبل شوي قلنا إن الفوكال نودولار هايبربليجيا shows homogeneous. It is homogeneous in on CT on the radiological modalities. لكن طالع هنا في الهيباتيك ادينوما it is heterogeneous. ايش معناتها heterogeneous؟ يعني طالع سي تي، شوف السي تي هنا، نشوف هنا في سواد هايبودنس، وهنا هايبر، وهنا هايبو، وهنا هايبو هايبر. ف this is a heterogeneous mass, heterogeneous mass. So this is a characteristic of hepatic adenoma. نطالع في الالتراساوند برضو this is heterogeneous. You can see here hypoechoic or hyperechoic here. Why is that? Because hepatic adenoma is associated with necrosis and hemorrhage. Necrosis and hemorrhage causes these features that are seen, causes the heterogeneity that's seen on hepatic adenoma. In CT scan, it is well circumscribed. شوف ايش قلنا حنا هنا، قلنا انها surrounded by capsule. Once surrounded by capsule, that means it is well circumscribed. Okay, خلصنا ال benign lesions. Now we will move to liver cysts. ايش معنى cyst؟ cyst باختصار معناتها كيس. Cysts are thin-walled structures lined by cuboidal bile duct epithelium and filled with isotonic fluids. هي باختصار عبارة عن كيس filled with fluid. More common in females. Can be seen as one or multiple. Often asymptomatic, unless it is very large. Often coexist with other mass lesions. Prevalence increases with age, common in elderly meaning. Ultrasound is the best imaging modality. Biopsy is not needed. Unless if you suspect malignant lesion or something like that, you have to do biopsy. Okay. Now let's see the liver cyst on ultrasound. Here is the liver cyst. قبل شوي قلنا انها filled with fluid. صح؟ زي ما مكتوب فوق. طيب دامها fluid معناتها anechoic. It is black. الفلويد ما يبان في الالتراساوند. increase through transamination. White أو increase through transamination يعني because لأن الليجن هذه مليانة فلويد فالأشعة أو اللايت easily pass through it. It is smooth, round margins, no internal echoes. يعني هنا ما تقدر تشوف بياض، كلها فلويد مليانة. أو السيست avascular. It's not vascularized. You cannot see here blood vessels or surrounding it. That's why we call it avascular lesions. Okay, again here is liver cyst, but with with the CT. Less than 10 house and field units. It is the same density as water, as we told you earlier. It is filled with water. Doesn't change with contrast. Okay, MRI finding of a cyst. Note, always remember the rule of 1 and 10. You can see here is hyperintense, that means it is T2. You can see here is hypointense, that means it is T1. Okay, this is a quiz. قلنا في الالتراساوند of hemangioma, hyperechoic, smooth, well circumscribed, homogeneous, well circumscribed and smooth. These are characteristic of hemangioma, while hepatic adenoma is something different, heterogeneous. So all دايم في خلال المذاكرة يعني حاول انك تقارن الاشياء بالprevious lesions. يعني الحين في الهيمانجيوما نقارنها مثلا بالفوكال نوديولار هايبربليجيا، نقارنها مثلا بالهيباتيك ادينوما. طول ما انت قاعد تذاكر حاول تقارن الاشياء ببعضها عشان توضح لك الصورة. في الاخير بتكون سهل عليك مرة تفرقها في الاختبار، تفرق بينهم. Okay, this is a CT of hemangioma. قلنا في CT hemangioma shows centripetal enhancement. طالعوا هنا هذا الليجن، وطالعوا في ال arterial base الايورتا مولع، بعدين يبدأ يولع من الأطراف، بعدين يخش للنص، بعدين يعبي كامل. هذه يسمونها centripetal، معناتها الانهانسمنت starts from the peripheries as here, then moves toward the center. Okay, here we have a CT of focal nodular hyperplasia. قلنا في الfocal nodular hyperplasia we have central scar. طالعوا هنا في central scar. طيب وقلنا enhances in the arterial base. وقلنا في الأخير السنترال سكار يولع، لكن الصورة هذه ما هي واضحة. المفروض السنترال سكار يولع في الأخير. Okay, that's all about focal nodular hyperplasia. Okay, now we will move to hepatocellular carcinoma. Most common risk factor for hepatocellular carcinoma is hepatitis B virus, commonly in males. Finally, lesions اللي previous lesions كانت common in females. Biopsy is not required for the diagnosis. The patient previous medical history, physical examination, radiological findings are sufficient. يعني جاك واحد عنده واحد عنده prolonged history of hepatitis B virus infection, وعنده hepatosplenomegaly for long period of time، وبعدين سويت له CT وشفت انه عنده features of hepatocellular carcinoma. خلاص يعني ما عاد بقى شيء، خلاص هو نفس الهيباتوسيلر كارسينوما، يعني لا تفكر في شيء غيره. Okay, what is the treatment? Liver transplant based on Milan criteria. ميلان كرايتيريا لها شروط للليفر ترانسبلانت، أو تسوي systemic chemotherapeutic agents with radiotherapy. Alpha fetoprotein is not sensitive or specific for hepatocellular carcinoma because it can be elevated and in many conditions. So don't diagnose a patient with hepatocellular carcinoma just based on alpha fetoprotein. Okay, here is ultrasound of hepatocellular carcinoma. You can see heterogeneous, ugly looking. طالعوا شوفوا يعني ما هو well demarcated. في heterogeneity within inside, so it is ugly looking. It is not like a cyst, not like focal nodular hyperplasia, not like hemangioma. It is أكثر واحد يشبه له ممكن الهيباتيك أدينوما، لكن عشان تفرق بينهم دائما اعتمد على الهيستوري عشان تعرف هل هو هيباتوسيلر كارسينوما ولا هيباتيك أدينوما. واحد عنده hepatitis B virus infection for a long time, this is most likely hepatocellular carcinoma. Female uses uses oral contraceptives for a long time, this is most likely hepatic adenoma. Okay, this is the features of hepatocellular carcinoma. Hepatocellular carcinoma, general feature of cancers, they lobe blood vessels. الهيباتوسيلر كارسينوما في الليفر surrounds يحيط به أكثر blood vessel. يعني كيف أقول لكم، يعني أكثر blood vessels كثيرة، باختصار أكثر من اللي حولها. فلما تعطيه الكونتراست في الارتيريال بيز الهيباتوسيلر كارسينوما على طول يشرب الكونتراست فيولع بسرعه في الارتيريال فيز، مع انه طالعوا شوفوا طالعوا السراوندينج تيشو، طالعوا الليفر، تو باقي هايبودنس. لكن هذا الهيباتوسيلر لانه كانسر وسراوندد باي لوتس اوف بلاد فيسلز يشرب الكونتراست بسرعه. طالعوا هنا في البورتال فيز، شوف الايورتا بدا يطفى، شوفوا الليفر بدا يولع، لكن الهيباتوسيلر كارسينوما طفى بسرعه، يسمونها early wash out. اوكي هنا نفس الكاركترستكس، هنا الهيباتوسيلر كارسينوما شوفوا كيف ولع بسرعه في الارتيريال بيز، شوفوا لونه مولع، وهنا طافي بعدين طفى بسرعه، بعدين هذا النورمال تيشو اوف ذا ليفر ولع. فهو احفظوها يشرب الكونتراست بسرعه لانه كانسر، والكانسرز لوف بلاد فيسلز. Okay, metastatic tumors. The most common malignant hepatic lesion is metastasis or metastatic tumor, not primary lesions. Okay. Now we will talk about liver abscess. As you know, what does abscess mean? Means pus. What does pus mean? Means dead bacteria, parasites, fungi, and white blood cells. You can see the hepatic abscess here. It is heterogeneous on ultrasound. Again, you cannot differentiate between the lesions. For example, focal nodular hyperplasia, hepatocellular carcinoma, liver abscess without history. You need history to assist you for the diagnosis. Okay, just based on ultrasound, you cannot differentiate. Okay, here is hepatic abscess. Again, نعيد نفس الرول حقتنا. T1 تكون hypo intense والT2 تكون hyper intense. طالعوا في الT2 مولعة وطالعوا في الT1 طافية. هذه MRI. Biogenic abscess means abscess caused by bacteria. The most common type of abscess, bacterial infection, often have multiple abscesses, presentation fever, chills, pain, and the picture is dependent on the causative agents. E. coli most commonly cause septic shock, Klebsiella associated with pneumonia, with red gelid sputum. So dependent on the causative agent. The origin is the portal vein. تعرفون البورتال فين او الجي اي تراكت، كل البلد فيسلز حقها كل البلد فيسلز حقتها eventually will drain into the portal vein, and portal vein, so any GI cancer or any GI infection must pass through the liver. So the liver is most commonly affected by the GI system. Like, what is the treatment of biogenic abscess? Stabilize the patient if the patient is unstable by ABC protocol, airway, breathing, circulation. Then give antibiotics. Here is give. Then give antibiotics. But first thing, stabilize the patient if unstable. So biogenic hepatic abscess. Biogenic hepatic abscess is characterized by something that's called target sign. You can see here is like target sign. طالعوا هنا هذه biogenic abscess. طالعوا هنا في البورولنت فلويد، بعدين يجي البايوجينيك ممبرين، بعدين الإديمة في الأخير. طالعوا هنا أوضح، هنا البورولنت فلويد أو البس، وهنا الممبرين، بعدين هنا يجي في الأخير الإديمة. أول ما تشوف كذا سواء في الأوسبي أو صورة أو في أي مكان، هذه تعرف إنها بايوجينيك أبسس، يسمونها تارجت ساين، أتوقع يسمونها تارجت ساين إذا ماني غلطان. This is a characteristic of biogenic bacterial infection. Amoebic liver abscess. It is caused by Entomoeba histolytica, parasites transmitted fecal orally, cyst in water, like other pathogens. Some people defecate in water, and some while others unfiltered water, they will drink it and they will get infected by the Amoeba histolytica. Presentation: amoebic dysentery, bloody diarrhea, and right upper quadrant pain due to involvement of the liver. Right lobe is the most common affected site. Investigation: serological tests. What are you looking for in the blood? Look for antigens for amoeba and stool over parasites. Look for cyst of Amoeba histolytica. How do you treat it? With metronidazole. Hydatid cyst is caused by Echinococcus granulosus through ingestion of eggs contaminated with dog feces. Sheep are intermediate hosts. Keep in mind, don't mix between dogs and sheep. Dogs are the ones that transmit the infection to you or infects you. Sheep are intermediate hosts. You are not infected by sheep. Treated by albendazole. I corrected this. Rupture of hydatid cyst can cause anaphylaxis, so don't try to remove it. If you see hydatid cyst on CT, that's correlated with the history of eating from contaminated food with dog's feces or something like that. Don't try to remove the hydatid cyst, otherwise it will cause anaphylaxis, because these contain antigens that are highly immunogenic. This is a characteristic of hydatid cyst. يعني لما تشوف هذه الصورة على طول تعرف إن هذه hydatid cyst that's caused by Echinococcus granulosus. يسمونها الواتر ايليساين. وش هذه طيب؟ هذه يا طويل العمر والسلامة، هذه الممبرين of the hydatid cyst, but it detaches and now it is swimming in the fluid. فيطلع لك الشكل هذا. هذه في الالتراساوند. في السي تي something else تولع highly echogenic. Now we will talk about biliary cyst adenoma. Biliary cyst adenoma is multiple cysts, you can see here. And in imaging, we will biliary cyst adenoma or cyst adenocarcinoma. This is the benign lesion, this is the cancerous lesion. Thick fibrous wall, moral nodules, internal septae. You will see here the septae. This is a characteristic of cyst adenoma. Papillary projections and contrast enhancements of the cystic wall. See, the cystic wall is enhanced. And in MRI, you will see homogeneous low signal intensity on T1. Again, we are repeating the same thing again. In T1 is hypointense, while in T2 is hyperintense. And that's it. And thank you so much.